Many of you have asked about what's going on with the pandemic of COVID-19 in Sierra Leone and how it's affected rural healthcare initiative. I'll start by sharing some numbers with you. First of all, the documented number of cases in Sierra Leone at this time is 1855, whereas in Minnesota it's over 57,000. The number who have died in Sierra Leone that are documented due to COVID-19 is only 67, and in Minnesota 1620. The population of Sierra Leone is about 2 million greater than Minnesota. So it might look on the face of this that there's not that many cases going on, but I think it's probably a much greater problem than these numbers would tell, because there's a lot less testing going on and less reporting. So I'm sure it's greater than this, but not nearly as high as in Minnesota. The majority of the cases have been in Sierra Leone have been in the Western District, in and around the capital of Freetown. And in the Bow District, where Takanko chieftain is located, there have only been 105 cases. Nevertheless, COVID-19 has severely affected RHCI in Sierra Leone in several ways. Starting on March 24th, President Bio declared a state of emergency even before the first case was documented. Schools and churches were closed, businesses closed, no large gatherings are allowed. There was a blockade to intra-district travel, and there were several lockdowns lasting 3 days or longer at a time. Here in the US, we responded by forming a committee, and this included team members from here in the US and in Takanko, to set up guidelines and safety protocols, which included things such as social distancing, no longer allowing visitors at the birth waiting home, masks, and our tailor started actually sewing masks, as well as increased hand washing and a number of other precautions. In early May, the devastating loss of Dr. Vandy Sambi due to COVID-19 was a huge shock to us and greatly affected our children's programming. He was the one that provided emergency care for the sickest children that our staff brought to him at the Bow Children's Hospital. 3 of our staff members had been with him the week before he became sick and had to be quarantined for 3 weeks due to his illness. He was a great physician, and it's a great loss. Our motorbike outreach clinics initially stopped for about a week because they were worried about spreading the virus, but it was determined that they were an essential service, especially for children having malaria and other acute illnesses. So they were restarted and continue now, using a lot of precautions, as you can see in this picture. In June, we halted admissions to Balmy Mother's Home temporarily because one of our staff members had been exposed to COVID-19, and we did not want our Mother's Home to become an epicenter of COVID-19. However, no new cases developed, and so it was reopened to admissions in early July and continues to operate. At the end of June, we canceled our shipment of barrels that we usually send, and have to postpone that till October. And then in July, with the cases settling down and no new cases developing, churches and mosques have been reopening, and flights into the country have been resuming. There's very few cases being reported every day, and not in the Bow District for the past several days. But there continues to be concerns that it could still become a major problem. So our staff are continuing to do their precautions with social distancing, wearing of masks, increased hand washing and sanitations, and many other things to prevent possible risk of transmission. The risk of health is not only from the virus itself, but it also causes a lot of fear in patients in Sierra Leone, so that they would not even come to healthcare for serious illnesses and immunizations. So that in itself can also have an effect. But we've been very fortunate that our motorbike outreach clinics continue to be very busy, and people have not been afraid to come to them. I'll answer your questions towards the end of the program.